Hi, my name is Paul Secor, and I'm the Vice President for Philanthropy for the Mental Health Association of Central Florida. And today we're celebrating World Mental Health Day. And one of the ways we want to do that is not just post your traditional graphic or just your, facts you can do for your mental health, but really to take a deep dive and explore how mental health relates to different communities, different groups, and different demographics. And so with me today, I have Jordanna Saunders. She's the CEO of Trauma Recovery Services of Arizona. Jordanna, thank you for joining us.
Yeah, happy to be here.
Well, this is great. Well, I know, you have a lot of different facets to your professional career. You've done a lot of things in mental health. You're a member of the Navajo tribe in Arizona. And so I'd like to get into talking a little bit about the Indigenous community and how it relates to mental health there. But before we explore that, tell us about how you got involved in mental health. How did you get involved in this field?
Yeah, so surprisingly, I took a career assessment. I'm
Okay.
a first generation college student, and my dad, was a laborer, and my mom kind of struggled career wise, jumping different careers. And my dad's advice to me was find something that's always in demand, find something that you love, and find something where you can work inside. And I took a career assessment and they said, "Oh, psychology fits for you." And I had never heard of psychology because I was born and raised on the Navajo reservation. So it was a new career, and actually found that it really suited me. So,
Oh, that's great. And so you have a really good perspective. Grew up in the reservation of the indigenous culture and everything. When it comes to mental health, what are some of the main stressors you feel like the indigenous community is facing that might be endangering their mental health, their mental wellness, or could be a potential, down the road?
yeah, I think when we talk about mental health for Indigenous communities, we have to really take a broad lens, and we have to look at some of those social determinants of health. So, really, some of the things that affect um, Indigenous communities when it comes to mental health are things like poverty, not having access to services, not getting timely access to services. Um, Stressors that impact them are, we're still in really mass recovery from a lot of genocidal practices. So, for
Yeah.
example, my parents, my grandparents, I'm the first generation that wasn't placed in boarding school. So when you think about how that impacts communities, if you're not there to learn how to parent, to learn those communication skills, to learn healthy emotional regulation, you're not able to pass that on to your children. So a lot of Indigenous communities are still grappling with what does that mean that so many of us were removed and now we got placed either in reservations or we relocated to urban areas, but didn't necessarily get that healing and reconciliation piece.
Mm.
And so that contributes to higher, suicide rates, higher substance use rates. And as a trauma practitioner, I know that those are trauma responses, people trying to, again, regulate, make sense of things, or get away from things that are negatively impacting them. So, so yeah, very complicated, but the long and short of it is we're still in that early, I believe in that early recovery phase of getting through some of those things that, just happened 30 years ago, 20 years ago.
That's true, and I guess probably too self-awareness that it's hard when you're in this and this is your culture, this is what you've experienced. That's the norm to you, I guess, right? And so to understand that you may be experiencing things that could be negatively impacting you probably slips by some people, I'd imagine.
Yeah, I think it does. I think it becomes kind of normalized,
Yeah,
again, like if you just were to like zoom into one thing and look at maybe the parenting piece and say, okay, well, what does it mean that my parents are learning how to parent with me and that they didn't have those role models? And then you compare that to other groups, and then you look at the socioeconomic disadvantages, right? You have poverty that piles on top of that, you have substance use. So it really just creates kind of this perfect storm of negative influences. And, what we find is that there are protective factors in there. Culture is a protective factor.
true.
So, we have our language, we have our histories, But we also have, these really systemic issues that permeate our communities. Um, so it's a challenge,
Yeah.
definitely.
Now, when it comes to that, how when the next step of trying to get help or getting help to people, how is mental health received, do you feel, in the Indigenous community? Is it something that's embraced, or we know it has a stigma in general, right? But do you feel like it's a greater stigma among the Indigenous community, less? What's your take on that?
Uh, yeah, I think there still is a really heavy stigma. A lot of that comes from distrust of the healthcare system, kind of like I talked about, those
Mhm.
genocidal practices, even like the Indian Health Services, for example, they're tasked with providing a lot of the healthcare for Indigenous communities, but they have a history of, say, forced sterilization of women. So, I think generationally, if you look at it generationally, each generation has their own perception and their willingness to engage in mental health services. We find that younger generations, so like I have a teenage son, like his generation is more receptive. I think that has to do with social media, a lot of awareness. Plus, people from my generation are a lot more open to psychotherapy, a lot more open to innovative healthcare, versus like my parents' generation. They're more reluctant, they're more distrusting. So I think it's generational, and I think that also there's a lack of BIPOC professionals, so that
Mm.
contributes to that distrust. Is like, well, why do you want to treat me? Why do you want to help me? Who are you? Are you here to do harm, or are you really who you say you are? You know?
Yeah, so let's talk about that for a second, because I know when I was searching for an expert in the mental health field that was Indigenous, it was very challenging for me to locate somebody in Florida, especially. What are your thoughts? Is the field underrepresented when it comes to Indigenous people, and for in the professional roles? And if so, what can we do to change that?
Absolutely. Yeah, we are underrepresented. We know statistically not only are Indigenous people underrepresented, but BIPOC people in general. Some of the things that we can do, I think, really are at the advocacy and the policy level, like, creating changes to how accessibility, graduate school is extremely expensive. And we know that BIPOC professionals come out with a higher debt burden than non-BIPOC professionals, and that contributes to them then leaving the field. There's another issue of compensation, right? So it's
Mm.
extremely hard in behavioral health to get adequate compensation for these folks that, again, are carrying this higher debt burden. So some things that we can do is creating pathways, creating career opportunities, prioritizing pay equity, prioritizing, offering fellowships, scholarships. I know when I was in graduate school, it was extremely hard to get paid opportunities or tuition reimbursement. A lot of those slots were often reserved for people who, didn't represent the community that I was trying to work with. So I think there's a lot of disparity still. I think there's a lot of opportunities. And that's kind of where my company came into play. Is I saw that as an opportunity, and also people calling.
Okay.
I was a practitioner, and then them saying, "Hey, we don't have anybody. We need you to be this." And it was like, "Well, I'm just me. How do I meet this need independently?"
Yeah, and so I know you personally reached out and kind of try to take a proactive role. What are some other ways? We talked about, it sounded like it was there's a huge issue with all these stressors, right? And then we also have compounding that is the stigmas. There's a huge stigma, distrust with going to get mental health services because of what people have experienced in the past. So now what's the step three in this? How do we get them, or the third phase, how do we get them now to step forward and trust services and get them beyond the increasing diversity in the therapy? Is there anything else we can do as a community as a whole for more outreach?
Yeah, I think affordability and accessibility. So ensuring that services are affordable, that regardless of people's financial situation, that they can get the services they need. I think that we need to stop kind of giving, limiting access to services. So, for example, in my practice, we do EMDR and we have a low no cost clinic. So 20% of our services are at low no cost. I know that you guys also do some really incredible work around that. I feel like, accessibility is huge, right? Giving
Yes.
people access to those services, because that's going to be what changes it. In my community, a lot of it's word of mouth. So every person that comes in and has a positive experience with therapy, they're going to go talk to 4, 5, 6, 7 people, and they're going to plant that seed of, hey, I did this. Look at the positive impacts in my life. And then those people are going to be more likely to say, well, maybe I'll try that. Right.
Yes.
And so we want to eliminate all of those barriers as much as we can. And by doing things like this, talking about, bringing it to light, talking about it, sharing about it, I think is really important because, you know, um, we don't want to contribute to what has been done before. We want to change that dynamic.
Absolutely. I think a lot of times, as in many different facets of society, we're taught that, hey, if you're experiencing something hard, your job is to push through it. Your job is to fight through it. That's how you get ahead, and that's how you are successful. And then, but I don't think we take much time to acknowledge, when somebody is going through a difficult time. And you're right. And then making services available, all the services we have are free of charge, and we provide free mental health therapy for the uninsured. So I think it's programs like that that are going to hopefully make a difference.
Yeah. Yeah, because, like we were saying, I mean, giving people access to what they need without the expectation, because I think that's also something that happens in my community where it's like, be strong, you're always encouraged to like deal with it on your own. And
Yeah.
I think that mental health is one of those things where we need a community, where this is not a pull your bootstraps up kind of thing and go, like you need a trained professional, because that is what we specialize in. It's sort of like you wouldn't like go duct tape a broken leg and tell somebody just to hop their way through it, And it's
Yes.
mental health, like go see the specialist, go see the person that has that specialized training that's going to help you navigate through this, because it is temporary. And I think that's the other piece is people think, oh, once I have a diagnosis or once I have this problem, I'm stuck. It's never going to change. And I'm sure you and your work, doing what you do, you see that where it's like, no, actually, this is a transitionary thing if you get the right help.
Exactly. Yeah, it's all about healing. It's all about getting better. Yeah, the end goal. What would you one of the things I always think about is if people are not kind of in the track to get help, right? Because there's a certain system, you almost got to thread the track to get involved. Let's say somebody stumbles on this video and they're located in a rural area, not really familiar with mental health or what services might be available, and they're Indigenous. What would you tell that person? What would be the first step, especially if they're younger? What would you tell young people that are Indigenous that might want to get some help for some of these specific issues you're talking about, but don't know where to turn to?
Yeah, I would say start with obviously with your network. I mean, you're going to know somebody that knows something. The nice thing too is a lot of Indigenous facilitated organizations exist. So in your area, kind of looking for those, whether it's an urban Indian health clinic, whether it's, if you're here in Arizona, looking for us, but looking for those folks because they are out there. It may take a little bit of time to find them, but we are out there. And being patient, I think, as you're finding, um, looking for those resources, but also having the expectation that you be treated well. If you reach
Yeah.
out to somebody and they don't return your call, move on and call somebody else. Like that's a big thing in our industry here in Arizona. For some reason, people don't answer phones, which drives me crazy. But
Okay.
you know, yeah.
Well, that's good. And you mentioned that you provide a number of services. So if you can, tell me what Trauma Recovery Services of Arizona does and how people can kind of connect with your offerings.
Yeah, so we provide telehealth-based therapy here in the state of Arizona. So we see ages 13 and up. We really specialize in working with marginalized communities. So we work a lot with Indigenous communities, BIPOC communities. We work with veterans. We see teens, couples, individuals. We also do group therapy. And really, our specialty is dealing with trauma. So our practitioners are trained in trauma modalities such as EMDR, which is a trauma resolution therapy. It's evidence-based. It's known to help with PTSD, but we can use it for depression, anxiety, all kinds of things. We also use TFCBT. We have a women's trauma group.
Oh, wow.
Yeah, and we are now launching this month a sexual assault program.
Okay.
So, really when you think about here in Arizona, we see that kind of what I was talking about before, that discrepancy, where in the urban areas we might have some specialty services, but in the rural areas and in the tribal areas, the specialty services are not there to meet the need. And so we really exist to try to like create that buffer, give people that safe space to reach out to. We take some commercial insurances, we take Medicaid, we take some Medicare plans, and then, like I said, we also offer the low no cost services. And so, we really try to help people along that spectrum of wherever they are financially. And telehealth is great; it's accessible. And we're also working to provide some hybrid services to some areas where maybe infrastructure is lacking, where telehealth isn't as available. So that's kind of
Wow.
what
So
we do.
it sounds
And
like you guys do a lot.
yeah, yeah, we do, and it's based on need. Like, what does our community need? And we kind of try to see, like, does this fit for us? Like, are we able to help? And if not, we can bring in partnerships. So.
Okay. All right. And what's the website if someone wants to learn more about your business?
Sure. It's www.trsofaz.com.
Okay. Repeat that one time. TRSO. I'm sorry.
TRSOFAZ.com. So
Okay.
it's just the acronyms for like Trauma Recovery Services of Arizona.
Sure, no.
So
Okay, that makes sense.
yeah,
Yeah, I just gotta, my brain's gotta catch up.
you're
So
like, wait, it sounds weird. And then you
yeah.
write
Well, we're
it
the
down.
same thing. We're the Mental Health Association of Central Florida. It's mhacf.org. And to me, it just rolls off my tongue, but the first time it doesn't. So, well, we
Yeah.
covered a lot. Is there anything you feel like we missed or we didn't hit up upon that you wanted to talk about at all?
Um, no, I think we kind of covered everything. I really appreciate that reached out to me. Absolutely, we're here to help. And just sending our like prayers and well wishes to all of you in Florida as you're preparing for what's coming now.
Yeah,
So,
Hurricane Milton. Yeah. So, well, thank you. I appreciate that. Yeah, thank you for taking your time out of your day. You answered my call cold, and I feel like this is what you got to do in mental health is reach out to people. So, thank you so much for your time today. We really appreciate it.
yeah, thank you.
All right. So again, we are celebrating World Mental Health Day. We want to thank everybody for watching and also encourage you to watch our other videos because we're interviewing all kinds of different representatives from different groups, trying to talk to them about mental health and what it means to their community. So remember to visit mhacf.org to watch videos like this and get more information. Thank you.